So once I've observed what's happening when Jack moves his jaw in opening, side to side, forward and back movements, then I want to be getting a measure. So I can be using this measure as an outcome measure following treatment in the future. I can also be using this measure to get an idea of what movements might be affected that's going to help with my clinical reasoning of what's going on. So Jack, I'm going to get you to open your mouth again as wide as you can. Again, let me know if you're getting any pain or discomfort, any noises when you do this. I'm just going to be measuring, so this will be lining up between your teeth, so I'm measuring from the top teeth to the bottom teeth. A really useful landmark for this is I'm measuring between the middle, so that line between the top two front teeth, and then the same line on the bottom two front teeth. So Jack, I'm going to get you to open your mouth as wide as you can. Good, and then I'm coming in with my ruler and measuring that line, so the middle line at the top and then the middle line on the bottom teeth as well. Okay, good, and then close. Usually the normative range varies pretty significantly, so it's really important to get an idea of if what I'm measuring is normal for him. I can just ask my patient that, does that feel like that movement is as far as you could normally go? Or is he getting any pain, clicking, clunking that's limiting it? Normative values, anything less than about 30 mil, definitely starts to impact on function. Anything more than about 50 to 55 mil, we're definitely starting to kind of think about hypermobility. You can obviously see that range is pretty broad. So I'm wanting to get an idea of what his current range is. Does it typically fall within that range, normative range limit? So is he between 30 and 50 to 55? Does it feel normal to him? And if it doesn't, what is he feeling limits him during that movement? I'm also going to be measuring side to side. So I want you to move actually, come back to the middle. So before I measure side to side, because we're using those same landmarks, I just want to get an idea of, are they lining up? In which case that he's starting from 0, or maybe his teeth are a little bit misaligned anyway, which is very normal. So before I measure side to side, Jack, I'm just going to get you to smile, and I'm just going to be popping this ruler up against your teeth, okay? So just smile, just normally, nice wide teeth, teeth together, good. You can see his lip is in the way, so I'm just going to pull his lip down just so I can see that line on the bottom teeth. And his lines up really nicely anyway, but if that was off to the side, like let's say his bottom teeth, that middle line wasn't lining up with the top one, I can be establishing what that overlap is as a baseline. So then if I'm measuring laterotrusion, I'm going to get you to move your jaw as far to the side as possible. Perfect, and then he's already moving his lip out of the way, so then I'm just going to be measuring again that middle line of the top teeth to the middle line of the bottom teeth. What we might often see when we try and measure this movement is that they open and laterotruge at the same time. So if they're doing we're wanting to cue that patient just to keep your teeth close, and I just want you to move straight to the side, not open your mouth. The other thing that we might be measuring is protrusion range. So for this one, we're coming more to the side, and again, we need to be establishing the baseline for this patient. So for protrusion, remember we've already had a look at whether they've got an overbite or an underbite, but that's going to affect our protrusion-retrusion measurement. So Jack, I'm just going to get you to smile again, just teeth together, smile normally, good, and I'm just going to move, yep, teeth together, good, big smile, great. And then I'm just going to be getting a measurement of how far forward his top teeth are from his bottom teeth. And if the plint's a little bit lower, I can be seeing that on the ruler. If you're a little bit unsure doing these measurements, sometimes it's nice at the start where you line it up and then you can just use a little marker or something like that on this. Make sure you're not drawing on the patient's teeth. So I would just be getting a little marker and just doing a little nick across there, and then I can take it away and measure it. And then, so now we're going to be measuring your jaw going forward, okay? So I want you to move your bottom teeth forward as far as possible. Good. And then again, I'm going to be getting that measurement from the top teeth all the way down to the middle of the bottom teeth, okay? When we're recording that, if I'm just using it as a reassessment for Jack, I don't really mind. His overbite, underbite probably isn't going to change a lot. His overlap in the teeth with the laterotrusion probably isn't going to change a great deal from visit to visit. So you could just record those values that I've gotten for Jack. If we're wanting to compare to normative, or if we're doing anything like, let's say he's got a problem with the protrusion movement, I might want to be recording that so that I'm saying, so for example, if he's moved forward 5 millimeters, but he's starting back 2, so he's got an overbite of 2 millimeters, he's actually got a protrusion range of 7 millimeters. So it's 2, which is bringing us to 0, and then it's 5, which is what I'm measuring with the ruler. Exactly the same with laterotrusion. So if we're measuring from the side and he's starting at 2 mil off to the, for example, the left, when I measure him going to the right, I want to do, let's say, 10 mil plus the 2 that he's starting from, because I'm just measuring from his 0, but he's not starting at 0. Normative ranges for side-to-side movement, again, these can vary a little bit. So side-to-side, typically we're expecting about 10 mil, but we'd definitely be comparing side-to-side. Most people are going to be 12 mil or less. If they're getting a lot more, again, we want to understand, is that normal for them? Is it potentially a sign of hypermobility? And maybe we need to be thinking about other hypermobility scales like the Baton scale. Are they hypermobile? Are they floppy everywhere? For protrusion range, typically we don't get as much movement with that. Again, it kind of falls between that 5 to 10 mil range. Definitely anything more than 10 mil, I'd be saying is starting to be a bit, is that normal? Or is it a sign of potentially hypermobility? So when it comes to measuring retrusion range of motion, to be honest, we don't measure this a lot clinically because we're not going to be getting much movement. It's the space of 1 mil or 2, and that's usually the degree of margin of error that we get with a ruler measurement anyway. So just to demonstrate, so Jack, if I just get you to smile, just normally, let us see your teeth. Good, I'm just going to move this lip out of the way. So you can see he's already sitting in a slight overbite position anyway, which is normal. And then I'm just going to try and get you to pull your jaw or your bottom teeth back. Yep, perfect. So you can see, now just smile. So he's not really getting much movement there at all. That's pretty normal. So if that's the case with retrusion, I'm just going to observe that rather than measure it. Most people, when they're having problems with moving their jaw, the most affected movements that we'll see, particularly for people that are getting clunky, locky jaws, are those with opening and those with protrusion. What happens at that jaw joint during those movements, we've got the condyle on the skull, and then we've got the mandibular condyle that articulates in that little cave. As you open your mouth, that condyle on the mandible is going to rotate and translate anteriorly. The disc sits on top of that like a little hat, and it should be moving in a coordinated manner with that condyle. So if there's a disc problem, often we'll see it when they open up their mouth because that disc is getting stuck or it's relocating and dislocating. Or it's when they protrude, which is when they're getting that translatory movement. So often in an active range of motion assessment, if they're having disc problems, for example, so those that are mechanical jaw problems, we'll see when they open their mouth, as that condyle is starting to translate forward, they're reporting a clunk or a click or whatever with that.